Hi, I'm Ken,
And I'm Yasmine, and
and
this is
this is
Conversations
Conversations
with
with
Ken
Ken
and
and Yasmin.
Yasmine. Well, here we are again, and we're going to speak today as educators,
Yeah,
both of us as educators, and very concerned about what's going to happen in the next few weeks, in the next month, awaiting for some sort of direction, a plan that would ensure the safety of our colleagues, of us, of the children, of our students and their families. And I understand the issues with childcare and matching that with parents in need of returning to work. I understand that with children in need of being in the classroom, having their friends, having that social aspect, of course. But I also am very aware of the need for health and safety and the rate of infections that have gone, that continues to rise. So I'm not hearing of a specific plan right now.
Can be
I'm not
referenced by school
okay,
leaders
but I'm not hearing a plan from the Department of
opportunity.
Education. Do you have a plan
But
for what
the
students and
plan,
what schools should do?
so
there is no plan. And on one level, they could set up specific regulations, but since the federal government did not close the schools,
That's
they
right.
don't have the ability to actually open the schools. So the biggest
That's true.
problem right now is that on one level, the pressure to open schools basically is focused on parents' ability to go back to work. I think that that's the sole focus right now because there's a lot of stuff that's happening that I just don't understand why we're trying to move this fast.
Exactly. And I don't think it's healthy or wise to be looking at other countries as our examples who don't have our population and who don't have our levels of infections. Oh, look at these countries in Europe and what they're doing. They've reopened or wherever, or in Asia, but look at our levels of infections and our rates, which continue to increase every day.
It's already July.
Hmm.
Most schools usually go back into session at the end of August, and we don't have a plan. Well, the federal government seems to not be able to put themselves together to create a plan. And I honestly feel is that because they don't want a plan.
Well, on one
Um,
hand, when they're asked for, on one hand, there's a directive, everyone has to return in September, end of August, whenever. But on the other hand, oh, well, there's no plan. You can figure it out yourselves. You individualize that, but for the one size fits all, everyone is going to return at the same time. But on the other hand, when asked for, well, what's the plan then for us to return? Oh, well, you can figure that out. We
right.
can't dictate that.
What do you tell parents and teachers who feel that it's unsafe to go back?
I would tell parents and teachers that you should find yourself a new person, whoever's in charge of that decision, because it's a terrible decision.
If we can standardize tests, we can actually do that when it comes to opening schools.
Right. And to argue that, well, children are young, elementary, middle, high school, they're young, and if they get it, maybe it'll be mild and they'll be fine. We don't know anything about this virus. We're asking questions and we're not really getting straight answers about what it is and what it causes.
These kids have got to get back to school. They're at the lowest risk possible. And if they do get COVID-19, which they will, and they will when they go to school, they're not going to the hospitals. They're not going to have to sit in doctor's office for days. They're going to go home, and they're going to get over it.
And then you have children going home to their parents and to grandparents, extended family members. You have teachers who are of a vulnerable age or who have pre-existing conditions. You have so many factors that aren't being addressed right now. And I find it amazing when we turn to leadership who are asked specifically over and over again, what is the plan? And they don't have one.
It's a balancing act.
It is a balancing act, but that we have to open our schools.
If you think about the years and years of when they've been basically packing as many kids as they possibly could into a classroom because of budgets,
Right.
basically trying to do this remote learning when it wipes out a whole certain aspect of the population that can't either have access to broadband or have the equipment and understanding that people learn differently in any shape, size, or form. I
Yeah.
mean, there are people that need that classroom instruction as far as socialization, the psychology of the kids about
Right.
actually being with other kids is important.
Right.
And basically
It
having
is. It
to
is.
have teachers be able to read the physicality of the student when they know that they're being confused or might not get things, being able to actually physically look at my students and see where the confusion comes in so I can actually add
Right.
things to my lesson to try and get them to understand things better. You
It's
can't do
also
that
your
online.
subject matter. It's also, from what I'm reading, you have certain populations who do better with in contact instruction.
Right.
So you have special needs students, you have ELLs, you have other students who really would benefit by having that in-person contact. But again, all these questions are unanswered, and the responsibility, again, without the support, is unfair. It's
You're
unfair.
right.
It's even unfair to local districts who are being told federally, you're going to have to come up with this plan. It's all on you. And on one hand, yes, it's your district, it's the culture of your school, the culture of your district. You should understand it. But on the other hand, we're dealing with something that's so distant from anything we've ever experienced. It's unfair to really throw people into that arena and say, it's all okay, it's up to you now. You're going to have to open, you're going to have to do this. But, good luck. I think, was it 75 New York Board of Ed employees
Mm,
died during COVID? I think it's 75, not just teachers, but paraprofessionals, support staff. That's, to me, one
right.
one
One is too many.
is too many. One is a lot.
Right. And
Okay, so
especially
don't
if you're not
say,
going
oh,
to.
we're only going to lose this many kids. No, no,
Well,
one
yeah.
is too
And
many.
at the same time, I mean, you've got to think about threatening schools for removing funding if they don't.
Oh, well,
You and the president have threatened to cut off funding for school systems that don't open fully in the fall. Here you are.
If schools aren't going to reopen again, that's breaking that promise. And so why should they receive funds for something they're not going to do?
The government doesn't have the power to pull back the funding, but to make this blatant statement to kind of shock parents and educators into doing something that nobody wants to take responsibility
yeah,
for making the plan and moving forward is just ridiculous. I mean, it's like,
yeah.
this is the reason why you get paid the money to be in the position that you're in. Make a choice, take the responsibility. If you're not going to do that with any type of, well, first of all, you need to have the skill and the ability and understanding to do that, which our
Yeah.
current Secretary of Education does not. But also on top of that, you actually have to have some experience when it comes to education to understand what's going on and how you can better implement a system that would work with the least amount of casualties possible.
And it's very flip, and it's very irresponsible to say, oh, just let them go back. Just open it all, let them go back, and to make a statement like that. And I'm hearing people say that, oh, just do it. Just do it and see. Just
Right.
jump on the ledge and see, and see without the net, and just try and see.
Each classroom is going to be a petri dish to see how this virus is going to spread.
Yeah.
And I think that that's unfair to the teachers, the educators, the parents. We don't know enough about this virus to understand really how it is spreading, how it's affecting people, basically understanding about what it's doing to the organs with the blood clots, the brain damage it could possibly cause as far as the blood clots in the brain, the things that are happening, what they've been discovering just from autopsies from people that have, succumbed to COVID.
And we know
And
people right now who've had it who are now feeling the effects of it, the fogginess
yes,
of the memory, the fatigue, the just the unwell feeling. I'm talking about people 3 months later who
right.
are feeling these effects.
I feel that as a society, it's easier to basically look at this as a graph rather
Yeah.
than the individuals behind it. That's why, some people would look at, 140,000 people dead. Well, that's just a number. They don't think about all the individual people that is affected.
Right.
And so when you're
That's a
able,
big number, by the
yeah,
way. That's a
And if you're
very
able
big
to
number.
distance yourself from the emotions behind death and just looking at it as a statistic, then what happens? I mean,
Why isn't there more mourning, Ken? Why isn't there more? I mean, I'm thinking about this 140,000 people. You know, children are left orphaned, people are without their spouses, partners. There are people, daughters are dead, sons are dead, daughters. I mean, sisters and brothers. Why? To me, this is such a tragedy. And I just don't feel like, and I'm not saying, we should just stop because we kind of have stopped, but
Right.
but I just think there should be more reflection for those who've passed, who've died, and I don't really feel it. I mean, I don't. When in my conversations with people, I don't feel that. I guess it's from our first show, the empathy, when we discussed
Right.
it.
This is what I think is important about healthcare workers actually getting mental care.
I was thinking the same way.
With
How
psychology.
do you go back
Yes, because there's no
without
way, like
support?
if you're constantly dealing with, I mean, these doctors are now seeing a rate of death that is so high. It's kind of like with my friends that were homicide detectives and seeing what they
Right.
have to do on a daily basis.
Yes.
They're talking about 10, 15 bodies like in a week, and these people are seeing this on a daily basis.
I'm
How are
hearing
they
so
going to
many
deal with their
doctors
mental
say,
health?
no, and hearing so many doctors say, I've never seen anything like this. I've never seen anything like this. I've heard so many of them say that. I've never seen
Right.
anything like this. And I look at them, and they are in need of help, of support. And speaking of essential workers, someone who was arguing that everything should be reopened for schools right away was saying, well, we should have made teachers essential workers to begin with. Well, I thought we were.
Yeah.
We were working the whole time.
Mm-hmm. Knowing that we had all this time
Mm-hmm.
since it started at the end of in the middle of a school year, in the middle between two sessions
Yeah.
is when most of this country started shutting down.
Mm-hmm.
We've had from there until now, without
You know what?
thinking
It was
about
like,
how
let
we're
me
going to.
close my eyes, it'll go away.
Yeah.
I'll wake up and it'll be gone. I think that was the mentality of people. Oh, it'll all go away. I'm just going to close my eyes and count to 10. Okay, wake up. It's gone. It's gone. No, it's not.
Yeah,
No, it's not.
we had enough time to think about what we needed to do, and it seems that
Yeah.
the past couple of weeks, like, oh crap, schools are about to open. What are we going to do? Well, how come we didn't start thinking about this in March,
Right.
in April?
Yes. And teachers in schools have been asking.
Yeah,
They've been asking, please, what's the plan? What's your guidance? There's no guidance.
right. The people that have the authority and the responsibility are now waiting to the last minute to do their job. But then, all at the same time, when it comes to education and the politics behind it, that's nothing new.
But what job? There's no job they're doing. They're just making a flip directive open.
Right, but
Figure
also,
it out. That's
even
it.
with the
Or else we won't
local.
fund you.
Right, and the local schools districts are trying to do their best with the
They
limited.
are.
Because the thing about it is, it's hard to plan for a disaster when that disaster keeps changing.
But they're waiting for their directives from the state level, and they're
Right.
waiting for their directives as well. I mean, there's this chain of waiting for directives. So local schools are doing the very best they can. It is a very difficult situation, but again, where they need the directive, and no one
Right.
wants to take that responsibility.
No, people don't want to take the responsibility in case it fails. At least from the federal government aspect of things.
But
If
what's
it's
your
a
definition
success,
of failure?
there's a certain percentage of death. If the numbers are high
One.
enough, where I pray that we get to a point where we truly understand that human beings or Americans are more important than just the statistics and the financial data that we create.
And I hope we get to a point where we can say just one death from this is too many.
Yeah.
It's been too many.
It's been too many. And I pray that, we get back to understanding what it means to be human, that humanity makes a return.
Empathy.
Hold on for a second.
Oh, that's loud. I heard that. That was loud.